is talk of quarantine fatigue in the U.S., though it remains the epicenter of the outbreak. The U.S. has the most cases of COVID-19 and the most deaths. Yet, as Jackson Proskow explains, 1/3 of states are beginning to relax or even end stay-at-home orders.
On the first day back in Georgia, business is not exactly booming.
We're trying to stagger our clients and not just load them in here so there's not so many people in here at one time.
There are few willing to risk it for a haircut or a meal. Movie theaters can reopen. Most are staying closed. There's no point when there are no new releases.
I have 10 employees who are relying on me in this theater for their livelihood, but I'm not going to try and make them choose between their livelihood and their lives.
That's not the case in parts of Texas.
We wanted chips and queso on the patio.
Where the mayor of Colleyville allowed patios to reopen over the weekend, there was a 3-hour wait for a seat.
They're sanitizing, they're wiping down, they're not giving anyone someone else's stuff.
Even hard-hit New York is considering a plan to lift restrictions in rural areas by mid-May. Health experts have warned it's likely too much too soon.
What happens if we dial back these social distancing measures, but then have to dial it up again?
Not one state has met reopening guidelines laid out by the Centers for Disease Control. The number of daily infections and deaths remains stubbornly high, and testing rates too low.
And in fact, there may be many waves of infections.
The fear seems to be what happens if the U.S. doesn't at least try to get back to business. White House economic advisors have warned the unemployment rate could rise to levels not seen since the Great Depression. Jackson Proskow, Global News, Washington.
There are new concerns emerging in the UK about how COVID-19 may affect some children. The NHS, Britain's National Health Service, has issued an alert to doctors warning there have been a small number of cases of children presenting with a multi-system inflammatory state that requires intensive care. The symptoms can include fever, abdominal pain, heart inflammation, and skin rashes. Some, but not all of the children have tested positive for COVID-19. It appears to be a form of toxic shock syndrome. It's not clear if a new COVID-19 syndrome is emerging in children in the UK or if it's an as-yet unidentified infectious pathogen. Having survived a serious case of COVID-19 himself, British Prime Minister Boris Johnson was back at work today. He'd been in intensive care and came home from the hospital 2 weeks ago. Johnson today urged people not to lose patience with the lockdown, saying this is a time of maximum risk, but that the UK is beginning to turn the tide. He said plans on how to ease restrictions will be released in the coming days.
If this virus were a physical assailant, an unexpected and invisible mugger, which I can tell you from personal experience it is, then this is the moment when we have begun together to wrestle it to the floor.
There is no widespread undetected community transmission in New Zealand. We have won that battle, but we must remain vigilant if we're to keep it that way. That includes safely returning more New Zealanders to work, enabling more businesses to reopen, and allowing some of the recreational activities we've missed in the past 4 weeks.
That's New Zealand's Prime Minister Jacinda Ardern. She imposed some of the strictest lockdown measures of any country in late March, closing schools, non-essential workplaces, and banning social gatherings. The country has just 1,500 confirmed cases and 19 deaths, and there have been only a handful of new cases in the past few days. So some restrictions on non-essential businesses, healthcare, and education are easing, but physical distancing continues, and people must remain in their social bubbles. Well, this is one way to get people to stay home. Police in New Delhi are dressing in helmets shaped like the coronavirus and walking through the streets. India imposed a lockdown on its 1.3 billion people last month to stop the spread of COVID-19. There are about 30,000 confirmed cases in that country. And in the middle of a pandemic, why not toss in some unidentified flying objects? The Pentagon has declassified 3 short Navy videos.
Look at that thing! It's rotating.
The official description is unidentified aerial phenomena. U.S. Navy pilots captured these images in 2004 and 2015. They'd been leaked before, and one of the pilots told reporters in 2017 that he believed what he saw was not from this world. The Pentagon decided to officially release them now to clear up any misconceptions about whether the footage is real. So we know the videos are real. We just have no idea what those objects are.
the new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.